knock knock.
Hi.
Hi, I'm Rich. I'm gonna be your nurse today. Can I get your name and birthday?
Name is Justin McEwen, and my date of birth is April 11th, 1989.
Beep. All right. Can I ask you what's the reason you came in today?
Just a general health checkup, just the yearly exam.
Okay. So what I'm here for, I'm gonna do a health assessment. It's gonna take about 10 minutes. So I'm gonna ask you a couple questions. So can I ask you, do you know where you're at?
I'm at the hospital.
Do you know what year it is?
2018.
All right. Do you have any allergies?
No.
And are you currently in any pain? And if you are, from 0 to 10, can you explain?
No. No, I'm in.
So I'd say 0 then?
Yes.
Alright. So now I'm going to start an assessment. So it's going to be a head to toe assessment. So first I'm going to start off with your head. Alright?
Okay.
So is it alright if I touch you?
Sure.
Alright, so I'm going to ask you to bend down lower for me.
Okay.
So I can see his hair is evenly distributed. No lesion or marks, no bumps. I'm gonna look at the ears now. There's no lesions behind the ear. No discharge. All right. Same with the other ear. All right. When I'm looking straight at him, I can see the ears are symmetrical. They're both even on each side. I'm gonna ask you, can you close one nose for me and breathe in? Can you do that with the other one? Alright, so nose is painted. Do you have any discharge today?
No.
No, not at all? Alright. And then I'm going to flash some light in your eyes, so can you look straight at me?
Okay.
Alright.
Hello, my name is Nikki. I'm going to be your student nurse.
Okay, pupils are equal, round, and reactive to light. Can you look at the tip of this pen for me and follow it? Alright. Eyes are accommodating. And then I'm going to ask you again to follow this pen. Alright, EOM is intact. Alright, I'm gonna ask you to open your mouth for me. Can you say ah? Alright, you can stop, keep your mouth open. Alright, thank you. So you will rise and fall in the midline. So his mouth is moist, pink. I don't see any lesion in his gums, no like scarring. Also forgot to mention his nose is in the midline. So I'm gonna ask you to cover one ear. We're gonna do a whisper test, see if your hearing's intact. So I'm gonna say a word. Can you just repeat after me?
Apples. Donkeys.
Yes. Alright. And then while he's talking to me, I can see that he's an alert and oriented for. Speech is clear. He seems calm. So now I'm gonna go down to his neck. So I can see right now he's not using any accessory muscles while he's breathing. I don't see any JVDs. Now I'm gonna check your carotid pulse. Alright, so his carotid pulse is +2, and now I'm going to listen to it.
Respiration is 20 on labor, and temperature is 98.6 degrees Fahrenheit. Pulse ox is 100% room air. May I take a look at your skin?
So his carotid, there's no bruit heard at his carotid artery. Now I'm gonna go down to listen to his breathing. So before I started looking at it, from what I can see, his chest is rising bilaterally. You can see that it's on both sides instead of just one. So now I'm gonna listen.
Your skin overall is going back to it. No tattoos, no rashes, no lesions.
Alright, can you breathe in for me?
May I palpate your head? Thank you. And upon palpation, there's no lumps, no lesions, or infestations. Your face is symmetrical, and it has symmetrical features. We're going to test out your
Alright.
eyes real quick. Do you wear any
Can you breathe in for me?
contacts? Or can you see without glasses and contacts? I'm going to have you look at the light for me. Look straight ahead. Your pupils are round. They're equal and they react to light. I'm going to have you look at the tip of this pen.
Alright, so His breathing was clear, no adventitious sound. Breathing was heard on anterior, posterior, bilaterally, in all 5 lobes. And so now I'm gonna listen to his heart.
Same thing over here, no drainage, no lesions. Looks like your ears are pierced, they are symmetrical and they're aligned to your eyes. Your nose, it is midline and appropriate with other facial features. I'm gonna have you look up a little bit. No drainage.
And usually you would listen to his apical heart rate for about a minute and you want to keep track of what it's at. And so at the same time, I forgot to mention this, if you want, right before you do the assessment, you want to take his vital signs. So in average, so I'm going to say his vital signs are within normal range. And so with his apical heart rate, it was regular. It was a regular heart rate. S1 and S2 was heard. And so now I'm gonna go through his arms. So I'm gonna feel his first pulse. So his radial pulse is +2 bilaterally. His skin temperature is warm, dry. No skin trigger. I'm gonna see for your capillary refill.
I'm gonna palpate your
Alright, less than 3 for capillary refill. Oh, and his skin tone is homogeneous to his race, and he's a pink undertone. And now I'm gonna check for your strength. So can you put your arms up and resist against me? I'm gonna push towards you. Can you push away from me? Alright. I'm the same with your legs. Can you resist? Thank you. Other one. Alright. So it's +5 strength bilaterally in arms and legs. So now I'm gonna go down to his feet. And so same thing. Usually you would take off his shoe and socks, feel for his pedal pulse. You want the pedal pulse to be a +2. If you have a hard time hearing, you can do this, his pre-tibial pulse in the back of his leg. I'm gonna check for edema. So usually you would lift the pants up and then you put pressure on it. And if you see any dipping, they would have pitting edema. So for his age, he shouldn't have edema. So I'm gonna say +0 edema. In the back, you would check for DVT. So do you feel any pain?
No.
Alright, and then you would look at it, see if there's any reddening or swelling. Alright, and then I'm gonna ask you, can you stand up? And then I'm gonna ask you to walk towards me, and then walk back. Alright, thank you. And his gait is steady. And then now I'm gonna go to his abdomen, so I'm gonna ask you to lay down for me. Alright, so for this, you would also lift up his shirt to look at his abdomen, but you can see from my perspective, his stomach is flat, it's symmetrical, you would see no masses, and then I'm gonna auscultate. Alright, so vowel sounds were heard in all 4 quadrants. And then you would percuss, but I don't think we need to percuss in this, so I'm going to just go straight to palpating. So, from what I can feel, his abdomen is soft, non-tender. I don't feel like any. Do you have any pain when I put pressure on you?
No.
Alright, and then what you want to do, you also want to palpate the urinary, so you see if any distensions. Any pain?
No.
Alright, I'm going to ask you to sit up. Alright, and then I'm going to percuss for his kidney, see if there's any pain back there.
Nope. Nope.
Alright, so that is for my assessment. Is there anything I can do for you?
No.
And also, hand hygiene. And also, thank you for letting me do this assessment on you. I know it took a little bit of time. If you want, I can get you some water and I can see when the doctor's going to be in. The doctor should be in here in about like 5 minutes or so.
No, I'm good. Thanks, Richie.
Alright.
Appreciate it.
No problem. Take care.
All right.